A concussion is more than just a bump on the head. It's a brain injury. Well, we'll look into holistic treatments helping patients recover from neurofeedback and peptides to oxygen-based therapies. We want to welcome back Chris Jackman, nurse practitioner at Carolina Holistic Medicine. Good to have you back. So concussions can be very serious. A lot are suffered very young in age, especially if you play sports. Recently, a friend of mine shared that she had a concussion when something fell on her head. So it's your head and your brain is a very sensitive organ, despite the fact that you've got this hard skull protecting it. So how do you go about using those holistic methods to treat something that could be potentially so very serious?
Yeah, so the first thing is, if you have a head injury or think you have a concussion, you should obviously go to a hospital and get checked out and get, and get a true diagnosis to make sure it is what it is. But once we know it's a concussion or a mild traumatic brain injury, then we can start the process of trying to reduce the inflammation, promote healing, and limit any long-term damage. So that's our goal, is to try to take the recovery process and speed it up to a point where people can heal and have no long-term effects from it.
How do you know when you have a concussion?
Normally, there is one of a few ways. You can either, black out or if you get hit hard enough and you lose consciousness, that's one way to know you probably had a concussion. The idea of like seeing stars, it's a real thing, by the way. It happened to me once in football. You get hit and it's like you see like stars just flash in front of your face. So that's usually a sign of concussion. Or it can just be you hit your head and within the next 15, 20 minutes you start realizing that your speech is a little slower, your memory is, short-term memory is fading, you're not as sharp as you should be, and maybe you should get checked out.
Okay, and so using these certain methods, neurofeedback being one of them, and I know a little bit about it. A friend of mine practices neurofeedback, as a matter of fact, and she certainly swears by it for a host of reasons. But how does this help with concussion victims?
Yeah, so the goal with neurofeedback is try to build that short-term memory back up and try to get the brain functioning and the synapses happening very quickly. So that way when you're having a conversation, you're able to think of what you're trying to say and say it and have that brain-mouth connection.
So what is neurofeedback exactly for anyone who doesn't
so
know?
what we do with neurofeedback is it's training of the body and training of the brain. So you'll provide them, words to remember. You'll provide them phrases to know. You'll give them things to read, and they have to try to read or say what you're telling them and say it back to you. So feedback what you're telling them.
Okay, so it's not invasive.
No, not at all.
No, but you can also measure brain waves and how the brain is responding to certain things as well?
Yeah, you can measure brain waves. You can look at how active the brain is, how well it's functioning, and all that. It depends on how aggressive you want to be with neurofeedback.
How about peptides?
Peptides, so healing peptides, the idea of healing peptides is just what they're called, to heal the body and regenerate the brain. So healing peptides can be used for a number of different things, but for the brain, they help reduce inflammation, they help provide neurons to replenish and rejuvenate and to heal, and allow the brain to kind of be relaxed so it has the opportunity to heal again. And
oxygen-based therapies, what would that be considered?
Yeah, so like ozone therapy or hyperbaric chamber. The big issue...
Are those safe?
They can be if done correctly and
I've heard horror stories about it.
It can be, and we always tell people they should always talk to us before doing anything like that so we can put parameters on and they can understand what they should and shouldn't do.
If you're claustrophobic, forget it.
Right, yes. Yeah, if you're claustrophobic, that could be a really scary place to be.
Yeah,
but if you do it safely, the idea is you provide extra oxygen to the body, and the more oxygen your brain has, the faster it can heal and the faster it can work well again.
Can you suffer permanent damage from a concussion?
Sure, absolutely. If you get enough of them. Usually one isn't enough to do it, but if you're getting 2, 3, 4, 5 concussions through a lifetime, you can definitely start having permanent damage.
You can, yeah. Because what about our young ones, those that are enrolled in sports like football, a lot of contact sports? They've done much better in making sure that kids, and also the pro players, have enough protection. But you're still hitting, you're still contacting, and there's still potential there for concussions.
Yeah, one good example, both my daughters, Harper and Everly, they're in gymnastics at West Ashley Gymnastics on the team. And they're really good. If a girl hits their head during gymnastics practice and they concerned for a head injury, they're done. Like, that practice is over. They don't get to continue even if the kid wants to. So we're much better at promoting head and brain safety nowadays, but there's still a lot of work to be done because it's something that's not overly understood as well as it could be.
And the first thing that you should do if you have suffered a concussion, is it apply ice? What should you do?
Yeah, if you have it's really, I mean, if you hit your head, you can always put ice on it. But really what you should do is you should notify someone so that way they can start to monitor you to make sure that
Should you lie down? Should you sit up? What do you think is best?
If you're concerned for like a brain bleed or anything like that, obviously you want to get to the hospital. But sitting up being and having someone monitor you for those symptoms of memory loss or slurred speech or loss of consciousness, that's the most important thing to do first. So let someone know you hit your head or you're concerned for a concussion so you can begin to be monitored and get to a hospital.
Okay, very good. Thank you so much, Chris. Appreciate it. We'll be back after this.